Thank you, Catherine. So my name is Tejas, and so this work is a collaborative work between the University of Texas at Dallas, the Department of Mathematics and Natural Sciences, and UT Southwestern Medical Center. So our aim is to evaluate short-term performance of epidemiological models under a Bayesian framework. Okay, so a brief introduction to, or some facts about COVID-19. So it's currently approaching 6 million cases across the US, and 170,000 deaths have already occurred, and it's crossed that number. And so forecasting of COVID-19 daily report data is of vital importance to government, health sector, and to the general public. For that, CDC has recommended 33 models for forecasting COVID-19 data. Out of them, 22 are compartmental models, which are your SIR, SEIR models, and so on. And we have growth models as well. So this presentation is more about the stochastic variance of growth models and compartmental models in general. So the public has some concerns like when would the pandemic be over? They want to know when they could get back to their normal lives. And the healthcare providers are concerned about the peak size and the casualties so that they have a good resource allocation and they have appropriate hospital beds and amenities available for the citizens. And for policymakers, they want to know if the government interventions are working or not, and whether business and school reopening should take place, and so on. So the only way we could answer all of these concerns is through reliable predictions, and we want to see how we want to propose models that do a good job in short-term prediction. So the objective of this work is to propose stochastic versions of existing growth and compartmental models under a Bayesian framework. And it's a unified Bayesian framework in the sense we want to add all those models under a single framework so that they're easily accessible and we don't have to, access different libraries or different codes just for a single, for all the models separately. So, and in the end, I will talk about comparing the performance of ARIMA. So we are comparing ARIMA, which is a benchmark model. It's a time series model with all the models in the Bayesian framework that we are discussing in the next few slides. So the COVID-19 data, so it includes, so we have denoted capital CT as the confirmed cumulative cases. And delta CT is like the first order difference or the new daily cases. So I'm just putting the notations right there. So when we discuss the modeling framework, it's much easier to refer to these notations. Similarly, we have deaths and we have removed cases and actively infectious cases. So removed cases is a term that is most likely used in compartmentalized models like SIR and SEIR models. So the removed cases are deaths plus recoveries. And the problem with removed cases are that the recoveries are underreported as of now. So the data is unreliable. And we'll talk about that much in a few minutes. And infected cases are just the cases that are currently infected, and they can be obtained through the cumulative cases, deaths, and the removed cases. And the data levels that we'll consider are country level, US state level, and US county level. So these are the three data cases that I'll be showing in the results section, and I've done the analysis on these three cases. So let me just give you a brief introduction on the Bayesian modeling framework. So once again, so capital CT is the cumulative cases. We have made sure that we know that the delta CT or the first order cumulative cases or the new daily cases follow a negative binomial distribution because delta CT is a counts data. So we can model them using a negative binomial distribution with a mean function g of CT minus 1, comma, capital theta, which is the parameter space of the model, and phi would be a dispersion parameter. So we are modeling the new cases through a negative binomial distribution. And we also follow a Markov process because, so the Markov process is just that the new daily cases of day t would only depend on the day t minus 1, and rest all the interactions are independent. So we allow the Markov process, so that's our assumption. So the next is just the complete data likelihood that would be a negative binomial distribution, so that G is the mean function and phi is a dispersion parameter. So the prior distribution of phi is assumed to be a gamma with appropriate hyperparameters, which would be chosen appropriately to be appropriate for the situation that we are dealing with. Okay, so let's look at the curve fitting problem. So as we know that epidemic data is not a simple data, it's not a linear trend, or not. It has a specific pattern involved. So generally we see an S-shaped curvature when it comes to epidemic data. So that S shape accounts for exponential growth at an early stage, then a linear or sub-exponential growth in the middle, and then reducing or dampen growth towards the end stage until it converges to a point where there are no new cases. Okay, so I just talked briefly about a sigmoid curve, which gives a solution that is S-shaped in graphical terms. So this is just a sigmoidal curve that I just mentioned here. And a more generalized version of this sigmoidal curve is a logistic curve. So it just looks like the same as a sigmoidal curve. It's just that we introduced fresh parameters, capital K and lambda. So capital K is the carrying capacity and lambda is the growth rate. And the capital A is just some constant that we'll discuss about in the later slides. So if we consider the cases in Texas, I just plotted the logistic curve. And as you can see in the left curve, I've just estimated the values of the parameters K, capital A, and lambda. The blue line represents the fitted curve, which looks much like an S-shaped curve, as I just mentioned before. And the black dots are is the observed data for Texas. Then the blue dots in the end are the predicted means using the Bayesian framework. And as we can see that we also have the respective credible intervals towards the end. And then if you look at the second plot, this is for new daily cases. And the dotted red line tells us what the peak size was, or what the estimated peak size was according to the logistic curve, which was around close to 11,600 cases on a given day. But as we can see, it was underestimated. The actual was close to about 15,000. Okay, so this is a great curve, but we can have a better framework or a better model that will do justice to such kind of a data in terms of prediction. So it turns out that this logistic curve is a solution to a nonlinear ordinary differential equation. So if we solve this equation, this is in a variable separable form, we can obtain the solution that we just saw on the graph. And then because our data is discussed in a discrete time interval, in the sense we are discussing it in terms of daily or weekly data. So for presentation, it's just daily data. So because of the discrete nature of the data, I have expressed it in terms of delta CT, which is a discrete version of this nonlinear ODE, where K and lambda are model parameters. So now moving forward to the stochastic growth curve. So now we try to merge the two concepts of ODEs and the stochastic framework of a negative binomial distribution that we just discussed earlier. So the G function that I talked about, we use the generalized Richards curve, which is an advanced or a more complex version of the logistic curve. So the only difference is that we introduce fresh parameters P and alpha, where alpha controls the curve symmetry and P controls the scaling of the growth in the early stage. So if P is 0, then that accounts for a linear growth in the early stage. If P is 1, that would account for an exponential, just like the logistic curve does. So if I plug in P equals 1 and alpha equals 1, we'll get back the logistic curve. And K, the carrying capacity, is the estimated final size of the epidemic. So because this is a Bayesian framework, we are supposed to assume some prior knowledge, and we do that by assuming a discrete uniform distribution for K from from 0 to capital N, uh, which is the population size of the region that we are discussing. And lambda is the growth rate at an early stage. We assume a gamma prior because of its support. And similarly, alpha also has a gamma prior, and P has a beta prior. And this is all because of their respective support. So we will take non-informative priors so that we can learn these parameters using MCMC. And then this is just a summarized table for all the models that I discussed. So GRC is the generalized model with parameters P and alpha. If I plug in P equals 1, we get the Richards curve. And if I plug in alpha equals 1 and keep the parameter P, we get the generalized logistic curve. And if I plug in both alpha and P as 1, we'd get the logistic. Setting the parameters P equals 2/3 and alpha equals 1/3 would give us a Bertalanffy curve. And here are their respective inflection points. And I won't go into much detail because of the time constraint we have. And the Gompertz curve is just a limiting case of growth curves in general. So now, so now moving on to the stochastic models. So we have an SIR, we consider an SIR model, and we know that beta and gamma are the respective disease transmission rates and removal rates respectively. And the three differential equations that account for these three models, we assumed a discrete version of these three equations in terms of deltas. So instead of using that deterministic framework, we instead used a stochastic SIR model, which condenses the three equations into one single equation, which is the first one that involves delta ST, which is the delta of susceptible cases. By plugging in ST equals N minus CT and the respective value for IT, we can condense this into one single equation. And then we can plug this in as the G function with the recovery data. The only problem is that the recovery data is, the removed data. The recovery data is not that well defined and it's underreported. So we model delta RT, or the new daily recovery data, by a Poisson distribution for some fixed gamma that we can obtain for data sets in which the data is well accounted for, the recovery data is well accounted for. And similarly, we assume appropriate hyperparameters for beta. So now, without further ado, let's discuss the model forecasting evaluation. So it's generally under a Bayesian framework, we follow the MCMC procedure. We generate samples of size U, and then for time intervals, for t equals capital T plus 1 to TF, which is after point T, the time intervals for which the data hasn't been observed, we do predictions using this negative binomial framework. We obtain a mean predictive number of cumulative cases by averaging over all the U units of each and every sample, and we do this for approximately 10,000 samples. And we can obtain these means using that method. So for model evaluation, we did something called time series cross-validation, in which the green dots are the training data, orange dots are the test data, and white are removed from the data set. And we do this we start with like 7 observations, and we learn those observations, and we try to forecast the next 3 observations using those 7 observations. And we keep repeating this process by adding 1 observation in the training data. And we'll end this process once once the data is complete, or once we have covered the entire data. And so we compute an error measure for the testing set. So we performed this evaluation for SIR and ARIMA for 20 countries with respect to confirmed cases. And we use an SMAP measure, which is a metric to evaluate model performance. So the lower the SMAP, the better it is. For country-wise, so for this analysis, I constructed, like for all the 20 countries, line plots of the SMAPE metric. And as we can see, initially the SMAP is high for all the cases, for all the models that are mentioned here, because we have less data. But as and when we keep learning the data, the measure reduces and it's close to zero. So the models are doing a good job. It's just that the curve in the peach, which is ARIMA, it's not doing that well compared to the growth models. And now the next plot is a Cleveland plot. So I average out the entire SMAP through all the time points into one single point estimate. And as we can see that the lower the SMAP, the better the model is. So ARIMA is indicated by the plus signs. So it's either average or below average compared to all the other growth curves. So in summary, so forecasting performance differed from time to time for the entire region. So no model was best for the entire time. And then the models learn more and more data, their performance improves. And the GRM, or Generalized Richards model, has been better, has the best SMAP across 7 countries. And the authors have also designed a web application to visualize all these results. Here is just a small screenshot of the web application. So feel free to explore this application, and the authors have worked really hard over this. And thank you everyone. So if you have any questions, feel free to ask me.